Okay, in critical care, we use life-saving equipment every single day, right? We trust it. But what if there was an invisible hazard lurking in the very devices we count on to heal our most vulnerable patients?
I mean, take a look at this. It's just standard medical tubing. You've probably handled something like it a dozen times this shift, but could this seemingly harmless piece of equipment actually pose a pretty big and preventable risk?
Well, the risk we're talking about comes from a chemical called DEHP. It's a type of plasticizer. Its whole job is to be added to PVC plastic to make things like IV bags, tubing, and even those complex ECMO and bypass circuits flexible enough to use. Without it, they'd be rigid and brittle.
So how does it get from the plastic into our patients? Well, here's the thing. DEHP isn't actually chemically bonded to the PVC. It's more like it's just mixed in. That means it can easily leach out into fluids, especially when things heat up or when lipids are involved. And from there, it's a straight shot into the patient's bloodstream as a known endocrine disruptor.
Now, this exposure is especially dangerous for certain groups. We really need to be thinking about our neonates and infants, whose bodies just aren't equipped to process these chemicals yet. Same goes for our patients on cardiopulmonary bypass or long-term ECMO, and anyone receiving TPN, which, includes a lot of oncology patients. Their conditions and the intensity of their care just puts them at a much higher risk.
And if you're wondering just how big this problem is, get this. Studies have found a 5 to 26-fold increase in DEHP byproducts in infants' urine right after cardiac surgery using standard circuits. I mean, that is a huge, measurable exposure event. It's not theoretical.
Okay, so you might think, well, I'll just check the label. But here's where things get tricky. A label that just says contains PVC really doesn't tell you the whole story. It absolutely does not guarantee safety under the real-world dynamic conditions we see on the floor every day.
And this really gets to the heart of it. True safety can't just be found on a label. There's a great quote from a safety analysis that says, "Biocompatibility cannot be inferred solely from material labeling, but must be evaluated within real clinical operating conditions." It has to be tested where it's actually used.
So, what can we do? This is where your role as a patient advocate becomes absolutely crucial. Seriously, nurses are in the perfect position to lead this change. We can advocate for DHP-free alternatives, we can inform the people making purchasing decisions, and we can get involved in product safety committees to push for change from the inside.
Because at the end of the day, this isn't just about what kind of plastic we're using. It's a fundamental issue of patient safety. The evidence is there, safer materials do exist, and protecting our patients really demands that we start using them.